The measure passes
from the state assembly.
The measure passes
to the state Senate. A majority of Democratic lawmakers in both houses approved their proposed state budget, a $327 billion spending plan.
We have to make sure that we are meeting the basic needs of Californians, and I think we're doing that in a responsible way.
Some really important investments in housing, in higher education, in wildfire prevention and public safety.
But the big issue front and center, whether to go along with the governor's plan to pause the state's expansion of Medi-Cal publicly funded health care by 2026 for undocumented immigrants. Newsom's plan also calls for undocumented people already on Medi-Cal to pay a $100 monthly premium.
We submitted a balanced budget.
At his budget presentation last month, Newsom said his proposals on Medi-Cal were a last resort, but he added he felt he had no choice in order to help close California's projected $12 billion deficit.
Investments that we are making that we simply cannot continue to make.
But Democratic legislative leaders put forth their own proposal that, like Newsom's plan, would pause Medi-Cal health care coverage for undocumented people. But unlike Newsom's plan, the Democratic legislative leaders' plan would reduce the governor's proposed monthly premium for the undocumented from $100 per month to $30 per month.
Our budget does continue to keep our promises to ensure that our most vulnerable Californians are safe and healthy.
That's what several Democrats argued, but other Democrats, including Fresno Assemblymember Joaquin Arambula, himself a medical doctor, argued the latest proposed budget does not do enough to protect the health of undocumented people in California.
Healthcare is a human right for all, regardless of immigration status, and that we can't be party to creating a two-tiered healthcare system that sees others as less than.
He was the lone Democrat to vote no on the budget proposal, even as other Democrats expressed similar concerns.
Even the suggestion that we slash programs on the backs of immigrants who, let's be clear, pay taxes is not acceptable.
Republicans, meantime, point to a new statewide poll this week indicating 58% of Californians are against the state funding health care for undocumented people.
The problem is it's not affordable. We just simply can't afford it.
When that originally was proposed, it was said it would be a $4 billion cost. It's $12 billion. It is clearly not sustainable.
And despite those concerns, the proposed budget passed primarily by a party line vote. Important to note, though, this is not final. Over the next 2 weeks, the governor and the legislature are expected to negotiate some final changes before the start of the new fiscal year on July 1st. Reporting at the state capitol, covering local news that matters, Tom Wallace, Fox 40 News.